We presented a ctDNA analysis on samples from a phase 2 clinical trial called PELOPS. That study enrolled patients with stage 1 till 3 early breast cancer, ER/PR positive, HER2 negative early breast cancer. And these patients were randomized to receive endocrine therapy with or without palbociclib for 6 months period. And then all underwent surgery and follow-up. So in this population, we basically collected blood samples prior to treatment at baseline and after 6 months of therapy. So these blood samples were analyzed in a collaboration with Guardant Health. It was analyzed using the Guardant Infinity platform, which basically uses methylation, a whole methylome analysis, and 750 plus minus genes as an additional analysis. And all these samples were analyzed, and basically we correlated them with the results of the clinical trial. We correlated with different clinical and pathological features at baseline and at surgery, and with the disease recurrence at 3 years of follow-up. So in the study we showed that around 40% of patients had ctDNA at baseline. We had 58 patients in total, and 40% of them had positive ctDNA at baseline. Most of the ctDNA was detected using the methylome analysis, and after 6 months of treatment, we had 13% of patients positive with ctDNA, which were 6 patients basically. And during treatment, there were different populations. There were patients who were ctDNA negative at baseline and remained ctDNA negative at the end of treatment. There were patients that cleared their ctDNA, and there were patients that had positive ctDNA at the beginning and remained ctDNA positive after treatment, with basically persistent ctDNA. And what we saw is that the presence of ctDNA at baseline is predictive, and that we saw that patients with ctDNA at baseline had higher chances to have higher pathological stage after treatment and higher residual cancer burden after treatment. In addition, we saw that the patients that had persistent ctDNA had a very high chance to develop disease recurrence. And basically, out of 6 patients with persistent ctDNA, 4 out of 6 developed disease recurrence, versus patients that were ctDNA negative, and there only 1 patient out of almost 40 patients developed disease recurrence.